Okay, so this video is going to be talking about mono. Mono is an upper respiratory infection which is caused by the Epstein-Barr virus, which is commonly abbreviated as EBV, the Epstein. And this patient is going to be one that presents with 3 F's and an L. So the first F is fever. The second F is fatigue. The third F is pharyngitis. And the L is lymphadenopathy. And the lymphadenopathy in mono is kind of specific. The lymphadenopathy is the posterior lymph nodes. They're symmetric. And if you get them tested in a lab, it'll come back commonly saying atypical lymphs. Because at this point, the lymph nodes are now producing abnormally shaped white blood cells. And they're not so bad to say that they don't function, but they do look abnormal, and so that's why we have abnormal lymph nodes as one of the causes. So we've got the fever, the fatigue, and the pharyngitis, the lymphadenopathy. Other things they're going to present with sore throat. Tonsillar enlargement. Could have exudate, might not. And then older adults, maybe jaundice. But typically, Epstein-Barr or mono is in younger adults, like age 15 to 24. And sometimes when children get it, they may have no symptoms or abnormal symptoms. So something that wouldn't immediately clue you in to the 3 F's and an L might present when a child comes in with this. So what do you do when you're suspecting it? If you have the 3 F's and the L's, then the first thing you're going to want to do is get a monospot test. And these are relatively inexpensive. What they do is they test for hermaphrodite antibodies. And this is going to give you a correct answer, about 90 to 70% of the time. In the first week, you're going to get 25% false negatives. So what does that mean in practice? So if they come in, you do the mono, you suspect mono, you do the mono spot, it comes back negative, and they come back, 5 days later and they're still having the same symptoms, go ahead and do that mono spot one more time, because they might have mono and we are just not catching it in that first week. Another option that's definitely more expensive is EBV, IgM testing. And what does that do? That's going to give you, an 80 to 90% correct answer, which is an increase from previous. So if you do the testing, you suspect mono, you get either a positive mono spot or IgM testing, then you're going to want to give this patient pretty specific instructions, because the risk of complication with mono is not that high, but if you do have a complication, it's pretty severe, can be fatal. So we want to be extra careful with these patients for that reason. So 0.1 to 0.5% of patients with mono get splenic rupture. So this means people are having increased spleen size and their LFTs are going to be increased half the time. And then the other thing that can happen, especially in children, is 5% of mono cases lead to airway obstruction. And why is this in kids? It's because their airways are very, very small. So definitely watch out for that. But how can we treat these people so this doesn't happen? Well, for the splenic rupture, what you want to tell them is they need to not play sports for 3 to 4 weeks. So they need to be feeling better. And then they need to wait for their symptoms to resolve. So about 3 to 4 weeks. There is no evidence that glucocorticoids or antivirals help. So glucocorticoids are still sometimes used, but there's no evidence that they help. Antivirals do not do anything, so nobody uses those. And then other than that, you're just going to do symptomatic treatment. And what's that probably going to include, depending on their LFTs. Because you're going to likely want a CBC on this person. You're going to maybe give them something for fever, something for pain, and then just general rest and fluids is really the mainstay of treatment for mono.